Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about retinol, or vitamin A. This is going to be the eighth in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. Without any further ado, allow me to present to you retinol, or vitamin A. Firstly, we're going to go into the very basics behind deficiency of retinol. Then we'll break down the science behind why patients are presenting the way that they do. Then I'll give you some takeaways to help you identify this disease. When a patient has retinol deficiency, they can have vision deficits and tegumentary signs and immune system impairment. And we'll go further into the science behind these presentations and the risk factors later in the presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. I think the slide is pretty cool. So, most of you probably have heard of rods and cones in the eye. Well, there's a visual cycle that uses retinol in rod cells, and there's a visual cycle that uses retinol for cone cells. Usually, when you look up the visual cycle, we'll just show you the one for rods. But if you look at the bottom right, I was able to find a picture that showed both the rod and the cone visual cycles in one picture. So, the visual cycles are important because it's just how retinol is used to create light sensitive pigments. When any aspect of the cycle is lacking, the rods and cones can begin to degrade. The visual cycle in cones, which is the bright, colorful light photoreceptors, is quicker than the visual cycle for rods. I've heard the efficiency is often accredited to the molar cells that you can see in the blue box in the bottom right. Due to the extra efficiency of the visual cycle in cones, the rods, which are the low light photoreceptors, are impacted first by vitamin A deficiency. All right, now we're going to talk about the epigenetics again. So, retinoic acid interacts with two families of cell nuclear receptors, RXR, or the retinoid X receptor, and RAR, or the retinoic acid receptor, to cause gene expression or repression. This is an important process in the differentiation and proliferation of epithelial cells within the skin. If this process becomes dysfunctional, some types of epithelial cells can become squamous cells, which is just another type of epithelial cells that produce keratin. Due to the excess number of keratin producing cells in this deficiency, it can cause an overproduction of keratin, which can build up around hair follicles, creating a bumpy skin appearance. Hyperkeratinosis is the broad term covering phrenoderma and other keratin overproduction diseases. It will be most noticeable in areas of the body that receive a lot of friction, such as the elbows, knees, and buttocks, as can be seen in those pictures in the top right of the slide. As stated in the earlier slide, retinoic acid interacts with RXR and RAR receptors to cause either gene expression or repression. An example of this mechanism occurring in our immune system is by retinoic acid suppressing naive T cells from differentiating into T helper 17 cells and encouraging Treg cell differentiation instead. T helper 17 is a pro inflammatory cell known for autoimmune reactions, and Treg cells suppress immune response. Vitamin A is vital for maintaining balance between these two cells for immune function. Here are some risk factors you can look out for. Alcoholism impairs vitamin A absorption due to intestinal damage. There is evidence that alcohol consumption decreases retinoic acid formation. Cystic fibrosis is another potential cause of vitamin A deficiency due to thick mucus blocking the lipases produced by the pancreas. This decreases fatty acid breakdown as well as lipid soluble vitamin absorption. Celiac disease is another risk factor because it causes intestinal damage and decreases absorption that way. As far as drugs go, orlistat, which is prescribed for weight loss, decreases fat absorption, which obviously decreases lipid soluble vitamin absorption. Cholestyramine and other bile sequestrants lower cholesterol by decreasing bile reuptake in the intestines. This process also decreases lipid soluble vitamins. Some subjective questions to ask would be about past medical history, and you should make note of cystic fibrosis and celiac disease. Ask them what medications they're taking. Make note of orlistat and cholestyramine and other bile sequestrants. Ask about any alcohol consumption and, of course, find out what that looks like. Diseases that individuals can be at greater risk for with vitamin A deficiency are xerophthalmia, which can lead to blindness, as well as phrenoderma, which we covered in an earlier slide. For clinical exam in the integumentary system, findings would be dry, rough bumps that have been described as resembling toad skin. Visual findings begin with night blindness before other visual changes. A patient may express decreased ability to see at night or increased falls at night. Immune system findings are potentially increased or recurrent respiratory infections due to an increasingly inflammatory autoimmune state. The main takeaways as far as the what, why, and how behind the presentation is that retinol deficiency can cause night blindness due to the rods not having the retinol necessary to undergo the visual cycle that produces rhodopsin, which is the low light level pigment. In the integumentary system, dry, rough bumps form from retinoic acid deficiency because retinoic acid interacts with two families of cell nuclear receptors, the RXR and RAR receptors, to cause gene expression or repression. If this regulation doesn't happen, then epithelial cells turn into keratin producing cells, which lead to an overproduction of keratin, which can build up around hair follicles, creating that bumpy toad skin appearance. This is called phrenoderma, which is a type of hyperkeratosis. The immune system impairments are also related to the genetic expression effects of retinoic acid. Retinoic acid can suppress naive T cells from differentiating into T helper 17 cells and encourage Treg cell differentiation instead. Th17 is a pro inflammatory cell known for autoimmune reactions, and Treg cells suppress immune response. Vitamin A is vital for maintaining balance between these two cells for immune function. And here are my resources. Thank you for watching. Note that I am making these presentations during a pretty busy semester, so I'm liable to have made some mistakes. If so, let me know in the comments, and if your correction checks out, then I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to the calcitriol or vitamin